We're getting into the coughs and cold season, so let's chat about something that can be a bit scary for parents, especially this time of the year: croup in kids, and the less commonly known epiglottitis. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered approach to solve their children's health issues. So if that sounds like you, make sure to subscribe to the channel for more content just like this. So what exactly is croup? Basically, it is an infection that causes swelling in your child's upper airway, which includes their voice box, the larynx, and the windpipe, the trachea. This swelling makes it essentially harder for them to breathe and gives them a really distinctive cough that sounds like a seal barking. In young infants and children, the airway diameter is much smaller, which means any narrowing of the airway from an infection or from swollen tissue would make it harder for the air to pass through. One way to conceptualize this is imagining that you're blowing through a straw, a small straw versus a big straw. A small straw, which is usually met with more resistance compared to blowing through a large straw. What causes it? Well, most of the time, croup is caused by a virus, usually the most common virus being parainfluenza virus, which accounts for over 75% of the cases. Croup spreads just like a regular cold or flu bug by this virus through respiratory droplets when someone coughs or sneezes. How does it show up? Well, croup often starts out like a common cold with a runny nose, cough, sometimes you'll see fever. And then if the swelling gets bad enough, your child might develop that loud barking sound. They may also have a hoarse voice and noisy breathing, especially when they breathe in. And that's called a stridor. And it's also a high-pitched whistling sound. These symptoms tend to be worse at night and can last for about 3 to 5 days. How does one treat it? Since croup can be diagnosed by a distinctive sound of the cough in a child, the good news is most cases of croup can be treated at home. It is important to monitor your child's breathing and energy level just to see how they are overall dealing with it. Children with mild to moderate symptoms will benefit usually from breathing in cool air. Now, since croup cases usually surge in the cold winter months, I often recommend breathing in cold air just outside or in front of a freezer to help your child settle down, especially if he is in the middle of a coughing fit. This will generally yield an improvement in the cough in about 30 minutes. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. For more severe cases in some children, or perhaps in smaller infants with symptoms such as having stridor at rest or labor breathing where you can see their chest pulling and breathing hard, it may definitely warrant further evaluation from a pediatrician or your child's medical provider. And there are some treatments that can be helpful for croup, such as medicated breathing treatments that help reduce the swelling in the airways. Please note, this video is meant to be an educational resource. Information here is not meant to substitute for diagnosing or treating a medical condition. If you are worried about your child's breathing, it is always best to contact their healthcare clinician. Now, let's talk about something a bit more serious, but thankfully much rarer: epiglottitis. This can be confused with croup, but unlike croup, it often is a much more serious condition that will need immediate treatment. What is it? Epiglottitis is a very serious infection that causes the epiglottis, that is that flap of cartilage at the base of your tongue that keeps food from going into your windpipe, to swell up. As you can see here, the difference between unswollen, healthy epiglottis tissue versus the swollen, infected epiglottitis issue, which you can see there's some obstruction of the airway. So when this swells up, it can block off the airway, therefore making it incredibly hard for your child to breathe. What causes it? Well, unlike croup, epiglottitis is usually caused by a bacteria. The most common bacteria is Haemophilus influenzae type B, or we call it HIB. This subtype of bacteria is covered by most routine childhood vaccines given at 2 months, 4 months, 6 months, and 12 to 15 months of age. Therefore, in vaccinated children, epiglottitis is less frequently seen nowadays. However, in unvaccinated children, Haemophilus influenzae type B still poses a serious risk to developing epiglottitis in young children who are exposed to it. How does it show up? Well, this one comes on very quickly and can be life-threatening. Kids with epiglottitis might have this sudden high fever, severe sore throat, difficulty swallowing, drooling, and a muffled voice. They often sit leaning forward with their chin out and their mouth open, just trying to get more air. If you're seeing this, it's likely a medical emergency, and I would recommend getting immediate medical help. During the winter months, when respiratory illnesses are on the rise, it is important to stay vigilant regarding our children's health. And while croup is very common in children this time of year, it is generally a less severe condition and can be treated at home. Epiglottitis is a close cousin, but is much less common, but it can be more dangerous. Both conditions tend to start out very similarly with a hoarse cough, but epiglottitis can progress quickly to something that will necessitate immediate professional intervention. Consider the vaccination schedule that your child has and make sure they are covered. Should your child have a persistent cough, labor breathing, or any of the severe symptoms associated with epiglottitis, definitely seek medical evaluation. In our Las Vegas-based practice, me and my team work with families one-on-one, offering concierge individualized care to each patient holistically, minimizing unnecessary pharmaceuticals and treating the root cause. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule time to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatric medicine.